While the impacts of a global pandemic, paired with national protests, laying bare issues of racial equity and economic disparity, have affected all aspects of the life of our college, we have seized opportunities embedded within this unprecedented time and will emerge from the crisis stronger and more resilient. As a community, we have put our creativity and compassion to work. We have stepped up like never before. We have drawn on our spirit of shared humanity and sense of service that defines us, and we have looked to the very tenets of osteopathic medicine and the unified perspective that mind, body, and spirit are interconnected to lend us the ability to heal. We have reaffirmed our commitment to educate osteopathic physicians, allied health professionals, and behavioral scientists of the present, for they will be part of social transformation, making significant contributions to our nation and to the world at large. I invite you to learn more about our approach to navigating this unique moment. Together, we have begun to embark upon our recovery process and future successes. I have never been more proud of our college community. In mid-March, as COVID-19 necessitated a transition to remote learning, faculty and staff, in conjunction with the Department of Professional Development and Online Learning, worked to transfer doctoral and graduate program courses to online instruction. In a little under 2 weeks, 300 spring courses transitioned to remote learning. Summer courses transitioned online as well. Teaching human gross anatomy in particular pushed the envelope of learning technology. Traditionally a dissection-based course, physician assistant studies and physical therapy students had augmented classes utilizing de novo videos created and led by college faculty. Their studies set the stage for incremental technological and pedagogical strategizing for best practices that will be applied to future biomed and DO anatomy courses. College faculty used e-learning strategies to engage students who were unable to participate in in-person clinical clerkships. DO students likewise participated in Virtual Hospital, a didactic program that included daily live video conferences, clinical decision-making exercises, diagnostic interpretation skills, and more. In response to the COVID-19 pandemic, the college awarded emergency grant funding to support students adversely impacted by process changes and campus closures, among other hardships. Subsidy was provided through the PCOM Student Emergency Fund, made possible by generous donations from the PCOM Alumni Association, faculty, staff, and other donors. In addition, the federal government provided significant funding through the CARES Act Emergency Fund. During this time, the college also received news that it will receive a $5 million gift, the largest in PCOM history, from Dr. Howard A. Hassman, class of 1983. The gift will be received as part of a charitable remainder trust, with proceeds added to the Hassman Family Endowed Scholarship. In March, healthcare delivery at the PCOM healthcare centers shifted to a telehealth model, allowing physicians to continue to serve vulnerable and underserved populations in the face of the COVID-19 pandemic. 5 clinical locations offered the model. Telehealth afforded increased access and safety for patients and providers. Primary care conditions and illnesses were treated and managed, and prescription refills and referrals were addressed. PCOM students on clinical clerkships in reduced numbers are again engaged in practice operations and patient encounters. When classes moved online and clinical clerkships were suspended, students across the college sought ways to get involved in the COVID-19 response. Student clubs and organizations supported local hospitals by fundraising, obtaining, and distributing PPE. One student used her 3D printer to craft face shields. Another student joined with engineers, physicians, and innovators to develop a low-cost, novel ventilator. Some students aimed to combat social isolation among older adults through check-in phone calls. Others delivered hot meals and orders from grocery stores to the elderly and the immunocompromised. Still, others sent snacks and words of encouragement to frontline workers. College leadership and staff donated PPE, hand sanitizer, and sterile lab equipment to hospitals and healthcare personnel in the greater Philadelphia, Atlanta, and Moultrie regions. College faculty shared their expertise on various aspects of the pandemic, including health, psychology, and education. And PCOM alumni across the nation fought valiantly on the front lines of the COVID-19 battle, preserving health and life. In April, the American Osteopathic Association's Commission on Osteopathic College Accreditation granted PCOM the status of accreditation with exceptional outcome, the highest level accreditation granted by the COCA. This accreditation status will be effective for 10 years. PCOM South Georgia was also reviewed in a separate action by the COCA, which determined all standards of accreditation had been met. In August, PCOM School Pharmacy accreditation term was extended by the Accreditation Council for Pharmacy Education through June 30th, 2028. In the midst of an historic public health crisis, the college's commencement ceremonies were held for the first time as online events, simulcast on the college's YouTube and Facebook pages. The ceremonies featured personalized videos from college leadership, faculty, graduates, and their families, and they were an engaging success, drawing over 31,000 viewers across the nation and world, an incredible tribute to the class of 2020. In light of the COVID-19 pandemic, the college explored ways to connect internal and external communities by refashioning and building remote, inclusive, and interactive events. This fall, PCOM Wellness Fest went virtual. Title sponsored by Independence Blue Cross, the program featured health and wellness speakers, fitness classes, and cooking demonstrations. The focus was whole person health and wellness. Proceeds benefited the PCOM healthcare centers. The college's popular Hershey Family Medicine Weekend Seminar also went online as a 4-day, 20-hour CME event. By electing to hold this course within a virtual platform, the Department of Continuing Education was able to reach a broader audience, over 260 participants. The college's transition to remote learning inspired a 10-part, strategy-focused webinar series created by the Department of Professional Development and Online Learning. Each session brought together between 200 and 300 educators, clinicians, and leaders from national assessment and accrediting bodies. And since the spring, PCOM School of Professional and Applied Psychology, the Office of Diversity and Community Relations, and the Office of Human Resources have offered a myriad of virtual discussions and webinars for the college community. Topics focused on mental health and well-being during COVID-19. Some webinars offered practical tips for working from home while parenting and/or assisting with remote schooling. In March, with the virus spreading, access to the college's research facilities became limited to the maintenance of essential materials. Safety policies and procedures were developed for the eventual reopening of the labs and research training programs. Despite the scale back of experimentation, literature searches, and data interpretation, preparation of manuscripts and grant applications continued. Virtual research laboratory experiences were created for students to familiarize them with techniques they would use when they were able to return to the lab. Meetings with faculty, research support staff, and students were held on a regular basis. Some students gave online research presentations at regional and national conferences. Abstracts and manuscripts were still published. Recruitment of subjects for the college's PCORI Award moved forward, and 3 studies for the Medicinal Cannabis Award were activated. As an institution that educates osteopathic physicians, allied health professionals, and behavioral scientists, PCOM has a responsibility to address structural racism and inequities that create and perpetuate healthcare disparities in marginalized communities. This past summer, the President's Commission on Racial Justice, Transforming Campus Culture, was convened to advocate for racial parity within all college environments and within the healthcare professions at large. The Commission's actions will underscore PCOM's unwavering commitment to justice, equity, diversity, and inclusion. The Commission, composed of 6 working groups, is tasked with examining the distribution of college resources to address equity, racism, and bias. The Commission will identify strategic priorities and initiatives that will be aligned with actionable steps in the new PCOM 2025 Diversity, Equity, and Inclusion Plan. The college's return to campus and recovery has hinged on a collective responsibility to preserve health and safety while sustaining institutional commitments to teaching, learning, research, and service. To develop plans for the fall and beyond, PCOM convened a Return to Campus task force. The task force carefully followed CDC, state, and local regulations while creating institutional safety and health guidelines. These measures have ranged from enhanced cleaning protocols to classroom and office reconfiguration, from student and employee symptom tracking through Campus Clear to RT-PCR testing and contact tracing. The guidelines require all those on campus to practice physical distancing and wear face covering. A return to campus framework set phases for the return of administrative and academic support personnel. Plans for fall academic instruction were determined by program. Some programs continue to fully employ enhanced methods of remote learning. Others have adopted blended instruction, moving didactic lectures online and allowing in-person, on-campus instruction in a limited capacity when it is essential to the course curriculum. Clinical core and elective clerkships, experiential learning, and practicums have resumed per the policies of the college-affiliated sites. PCOM remains dedicated to providing a robust and meaningful education and experience in a manner that is safe as possible for all involved. Through the COVID-19 crisis, the college community demonstrated that it is resourceful, innovative, responsive, and adaptable, capable of embracing change while prioritizing a forward-thinking approach. To that end, the college has moved ahead with the creation of PCOM 2025, a comprehensive strategic plan. Upon approval from the PCOM Board of Trustees, the college aims to launch the plan in January 2021. The plan's vision pivots on transforming health profession education, including osteopathic medicine, allied health, and behavioral science by integrating human connection with innovation and research. Key goals focus on student success, securing clinical experiences, innovation and technology, organization infrastructure, revenue stream diversification, and diversity, equity, and inclusion. Now is a seminal moment for the advancement of health profession education. PCOM is positioned to lead the way.